Injectable moisturising treatments, the sort that place a really thin layer of fluid hyaluronic acid gel just under the surface of your skin, have become hugely popular because they can give skin back that bounce and glow that it tends to lose as it gets older. And they're not just for the face. So I have come to Knightsbridge to visit Dr Priya Chadha and find out about Restylane Skinboosters, which are the original skin conditioning injectable treatment, and to see what she can do for my hands. Priya, injections with hyaluronic acid gel, the ones that just slip under the skin, they're really popular because people know they hydrate the skin, but they're actually doing a good deal more than just hydrating, aren't they?
Yeah, of course. So if you consider the skin and all of its processes and how it will age, the concept of a lack of hydration isn't the only feature in isolation that occurs.
Sure.
Certain hyaluronic acid-based skin boosters can definitely target different components of those, like improving the texture and the fine wrinkles and hydrating the skin.
Okay, and how is something like Restylane Skinboosters doing that?
So in regards to Restylane Skinboosters in particular, they've got 2 or 3 specific technologies: the cross-linking, the natural technology associated with it that gives it the longevity and also ability to improve your textural changes.
Okay.
We know that HA-based skin boosters will hydrate, but actually what they'll do is stimulate the fibroblast, elastin will improve, collagen will improve, and actually the whole process will begin to wake your skin up and say, you were going to sleep because we were aging, time to reboost you.
So what is the treatment protocol? Is it a one-off? Is it a course of 3? How many treatments do you need?
The educated consumer needs to understand facial aesthetics treatment is an investment in your time over a long period for the best outcomes.
Yes.
And Skin Boosters illustrates that beautifully because you cannot have a one quick fix, but if you can follow the course, which is 3 treatments, 4 weeks apart, and come in for those, and then you're into the maintenance, which is just 1 treatment every 4 to 6 months.
Okay.
And that will last you up to a year.
Okay, and if it's not an instant result, where along that treatment program do you start seeing the results? Is it like after a couple of months?
Yeah, no, they definitely see results 2 to 3 weeks after the first treatment.
Oh, okay. And these products are not just for the face, are they? Where else can you use them?
No, so they're certainly not. One could theoretically use them in many places, but
like wrinkly knees?
Yeah, well, so people
I've never bothered, but I know some people do worry about their knees.
Yeah, they do, and so back of elbows as well.
Back of elbows,
so actually, globally, they can be used much more. It depends on the culture and the type of and the country. But here in the UK, the predominance is certainly the face, of course. Then the décolletage, neck and décolletage region. Yes. And then because that suffers a lot of damage, you know, and also the dorsum of the hands, back of the hands.
Yes, which is what I'm interested in. These are my hands. and they're always covered with little nicks and cuts. But yeah, what kind of difference can people see in their hands?
So there's wrinkling and a fineness to the dermis that occurs. They become very thin and crepey. We know, especially with you as well, that some patients, because their thin skin becomes a little bit thinner, their veins can become a bit more prominent. And although I actually really like that and find that really elegant, some people don't.
I don't like the knobbly veins, but you know, I know the veins are testament to, you know, also lots of exercise
lots of
and
circulation.
stuff, and circulation, and I
But
don't
you can
mind,
improve,
they don't bother me.
Yeah,
you know,
and one can improve the quality of the skin such that they become a bit more subtle to aesthetically look at. Nothing to do with the veins themselves, but the skin quality just improves.
Will it hurt?
There's always a small pinch. There is. I don't tell my patients that there's not. The dermis on the back of the hand can be elevated. It is quite thin. One can definitely appreciate that you're in the correct layer.
Yeah, okay.
We're going to treat the back of your hands, which we've now cleaned and been kind and given you a bit of anaesthetic cream.
Thank you, yeah, appreciated.
We're going to do it with the cannula because it just means a little bit of less trauma. Yeah. And we've got good laxity to your skin, which is actually exactly where it should be for somebody of your age, so it's not excessive by any means, which means that we'll get a good gliding plane for the cannula to go in and come out.
Okay.
And it will be about 3 or 4 injections where we'll do small V's and deposit the product. And what we'll be doing is actually having a small click for each deposition of product, which is the Smart Click technology on the syringe.
Okay, what does that do?
So what it means is that, I'll click it here now. It now means that you'll have a deposition of product that is specific, because it only delivers a certain amount per site, and it allows me to treatment plan. So I know per syringe I've got 100 clicks, and I'm using 1 ml per hand. So it'll be about 50 on this side and 50 on this side. But we'll see, 1 ml, we'll see how your hand responds. So the main things on the back of the hands for any practitioners who might be looking or otherwise watching is certainly to avoid any of the veins, just because it will be unsightly for bruising. But otherwise, just to make sure that the plane of injection and depth is correct, to avoid any vital structures, which mainly is your extensor mechanism on the back of your hand, so it allows you to extend. We'll be doing injections 1, 2 and 3 moving along. So small sharp scratch for you, so sharp pinch, 2, 3, and that's it. The back of the hand can certainly bleed, and it does, because we know there's vessels there. And then we just find our plane, and when you've got the right plane, you just slide in beautifully, and it's not a problem. So the vessels just need to be avoided, but they tend to move out the way for you, as you can see, just like that. And don't tug with them and don't push. And then we will have, lifting up the skin can sometimes also help, just like that, and a deposition of product along the entire length of the cannula. And then once that's been done, you can just move, and if you just flatten out your hand, that's perfect. Use gravity to our favour, and you can see we're coming across the vessels, but we're just going to let them move out the way. We don't tug with them, don't irritate them. They will always not thank you for it.
Actually perfectly comfortable, which is really surprising to me. I can hear the click.
And that's a small deposition of product each time.
Wow, how neat.
So we've done 1 and 2, we'll now manoeuvre. And obviously to target the more distal aspect of the hand, we'll have to make a small insertion point a bit higher, because cannulas come in certain sizes. So we just bypass that vessel there, we don't tug it, we don't try and go through it. So you can see the depth there that's being achieved. And with patients with a bit more skin laxity, you can lift up even more so.
Okay, but you're just under the surface.
Yes, exactly. And just because I can, I will orientate to feather round, and then I'll feather round. So some people commonly treat these in linear with multiple injection sites, but it's fairly easy and new to. Right, so that's about all achieved from that one injection site, and then we'll move on.
Okay, I feel it working its way along, but it's comfortable, which is amazing. So Priya, what do I do now? What's the aftercare?
The aftercare after skin boosters from Restylane is actually really lovely and simple. We don't really advise any encouragement of massaging. There are no lumps to be seen. No. And so now you just let the product work, and it will take its time. And what you'll see in the next 2 to 3 weeks is an improvement in the fine lines and texture, and then a hydration of the skin that will improve its overall appearance.
Okay.
But really, by the time you're coming to the 4th week, when you're having your second treatment, after that is when you'll see.
And so immediately, are there any things I should and shouldn't do?
No, not really. We've been very lucky. You haven't bruised in a very vascular area, which is great. You'll be a little bit sore, so taking it easy is always advised. No, we don't look. I'm not particularly precious about these types of treatments. If you said to me, I must go to the gym and heavy lift, I'd advise against it.
No,
but I would say there's no absolute contraindication for it. You're going to be sore. It's like having injections for vaccinations. It's sore. You don't really want to do anything. Let your body and your hands recover for 24 hours and then resume everything as normal. You can wash them as normal, you can hydrate and use moisturiser as normal, but if you could hold off for everything for 24 hours, I'd be a happy practitioner.
I'll do that. Thank you very much.
You're welcome.
Okay, so that was Restylane Skin Boosters in my hands. This is the first treatment. We'll wait and show you what the afters look like after 3 treatments, but for now they're looking smoother, they're feeling fine, not bruised as you can see. So thank you very much, and thank you for watching.